have a child who's got anxiety and communication, aka selective mutism, and you think, I think that my child needs therapy. Does every child with selective mutism need therapy? Well, this is what I'm going to be chatting to you about in this video. Welcome back to my channel Word Steps. I am Anna Biavati-Smith, a speech and language therapist with the passion to talk to you about selective mutism, because this is really what I mainly do. So you will find many other videos in this channel. Now, therapy is one of the questions that I get asked most of the time. Now, what does therapy mean? Does it mean that your child needs to be fixed? Does it mean that your child needs a one-to-one and kind of being taught how to do it? Well, therapy for us means actually a family dynamic approach, and that's actually what you will find in my course, which is Steps to Brave Talking. Do not think that when your child, or if your child requires some support, is done just on a one-to-one in a little room. Therapy means that is guidance for you and everyone else around your child. And in fact, one of the first things I do is to set the right environment. But actually, every therapist that I support, and in fact, if you're a therapist and if you need any support, contact me and you'll find the details below. So it means that we do not focus only on your child's difficulties, but we look at a family dynamic approach because we all are scared of something. The therapy per se means that you have an expert or somebody that has a lot of experience about selective mutism, and we look through things like desensitization, sliding in. We look at how to help your child use their voice in anxiety-provoking situations. So one of the things that is really important is to create a ladder, and that obviously is done with yourself, where we understand the place, the people that your child speaks to, and the activities that your child loves. So therapy is created around this kind of triangle because there is a higher success rate. So think, for example, that your child loves being with you, that you're the mum and the dad or the grandparents. Your child loves playing football, but gets quite scared at playing football in the park, but really loves playing football in your back garden. So what we do is we'll look at the people, the activity, and then we only change one variable. So in therapy, I slide myself in, and if you are unsure about what sliding in is, you'll be able to find other videos, but I'll explain it to you in great details in my course. And I play with your child, and then I come into the nursery or in early year settings, because it's through games that your child is going to be able to use the voice. So all the other steps are then done practically, like going to the supermarket or going to the park or having a friend over, because therapy in a therapy setting is really, really dry. How can your child overgeneralize? I'm sure you're asking yourself, but what happens with older children or teenagers? And that's slightly different, meaning that with an older child or with a teenager, yes, they require more one-to-one in order to understand how the brain works and What do we mean by problem solving and understanding the steps, but above all, having your child on board. I have to say, I mainly work with younger children between the age of 3 till the age of 10, but even with teenagers, we do practical aspects because they need to understand how to apply the little steps in everyday life. I know I've made it sound easy and it's not, but every therapy is tailored around your child. We spend a lot of time gathering information and understanding the family dynamics and what works and what doesn't work. And that is one of the most important things for therapy to be successful. So for me, as in the steps to brave talking, the success of therapy is that we're all working together. So we are creating a team around the child. So the school, yourselves, the relatives, friends, so your child gets supported and it doesn't feel that your child has a problem, but in actual fact, we are starting to work our brave muscle in order to tackle those difficulties. I'm really curious to hear, have you ever heard of the brave talking method? Please comment below and remember to let me know how old your child is and where are you writing me from. I hope you found this video useful. Please share it with who you think might benefit from it, and come and join me with the other families on Facebook on my group called Selective Mutism, My Child is Scared of Talking. Remember to subscribe because I post every week, and if you have any requests, pop it below. I look forward to seeing you next week. Bye bye.